Team, we are waiting on you to allow video access to the doctor. Doctor, just give us 1 minute. We have sorted out the video issues. You should be able to on your video anytime now. Dr. Geeta Seth, could you please try owning your video now? I believe our team has granted you access.
Okay, I'll just check. Yes.
All right, ma'am. We can see you loud and clear.
Hi,
Please
good
go
evening,
ahead.
everyone. Good evening, everyone. Thank you so much for inviting me on the World Hepatitis Day to share something about all this. Thanks a lot. Am I audible, please?
Yes, ma'am, you are audible.
Am I audible?
Yes, ma'am, you are audible.
Thank you. Okay. So you can see the video. I think I can see the video also now. I'll just see if there's anything.
Yes, ma'am, your video is visible.
Yeah. Thank you. Thank you. Thank you. Okay. Okay. So friends, what do you all think? What is a liver? What is liver's role in our body? Well, do you know it is the second largest organ, a very meaty, a double-lobed organ in our body, and how much of work it does, a normal man cannot even imagine. You know, once it was compared, and they said that 500 factories can be made if you distribute the work of liver. So it does all its work simultaneously. And today on World Hepatitis Day, I want to tell you the importance of liver first, and then we'll go to hepatitis. Now, this second largest organ, it weighs around 1500 grams. It's absolutely meaty, brownish in color. Anyway, the largest organ in our skin is, as you know, it's our skin. So this is the second one. Now, what happens that with our lifestyle, with our daily food habits, with our exposure to so many things, the liver gets totally affected. I would like to share my screen first with you so that we can talk about it. I'm just sharing it. Okay, so the second largest organ, liver, is one of the best thing the body has. It's on its own. Just a minute. Let's talk about hepatitis. You know, hepatitis is a condition of liver, which is our second largest organ, as I told you, where the liver gets inflamed. So what happens when the liver gets inflamed? You know, it has got many small works, minute works, major works, but the moment the cells of our liver start getting inflamed, naturally it underperforms. For example, you know, it has to turn the glucose from our food, and it has to turn it into glycogen and store it for the emergency times. Then what will happen? If the liver is already inflamed with hepatitis, this is going to underperform. This is not going to happen in its full way. So let us remind ourselves that liver performs many functions to keep the body going well. It's a chemical factory, largest solid organ, as I told you, 1.5 kilos. It handles 500 important activities simultaneously. Simultaneously means it so many works keep going on, and all the factories are on. What does the liver do? It protects us against infections and diseases, which we see in everyday life. We are in contact with such environment that we can get all this. It controls our blood sugar levels. This is very important. So when you are fasting the whole day for any reason, and the body goes low in the sugars, which it does not get the food we eat, that time the liver comes like a monitor, and it helps, gives the glucose which is stored in it as the form of glycogen in the body, and it helps us. In the same way, it also regulates the cholesterol. Liver is very important when it comes to our lipid profile. When we check a lipid profile of a patient and you see that the lipids are deranged, the triglycerides are high, the cholesterol is high, that means somewhere other than the liver, the diet is also playing a bad role, where we are, filling the liver with more and more fats. Anyway, it also aids in blood clotting, and it makes many vital body proteins also. Not to forget that it aids digestion also. How? Do you know how much how much bile is produced every day? So liver processes nutrients, filters the blood, and fights infection. It produces around 800 to 1000 ml, that is nearly 1 liter of bile daily. What does the bile do? The bile eliminates waste and harmful debris from the circulatory system. So the blood circulatory system is throughout going through the liver, and the bile is helping in that. This is a very, very important function of the liver. Now, what happens when we are talking about hepatitis today? Simple, I'll just shorten it. Heavy alcohol consumption, toxins, and certain medications, they cause liver. Now, there are 5 types of hepatitis: A, B, C, D, and E. Well, if the liver is damaged, it should be treated immediately. Don't forget that. You should not neglect anything which is giving you a problem. By the way, there are problems. People go with hepatitis for years unnoticed, because many a times the symptoms are not there. Although there are symptoms like, you have stomach ache, you can vomit, you have that vomiting sensation, and there is pain on the upper abdomen. Your urine can be more yellow. Of course, jaundice is one part of hepatitis. So if you don't get these symptoms, does not mean that you might not be suffering from hepatitis. So what is the best way to know if the liver is doing well or not? Just go for the blood test. Get your SGPT, SGOT done, and see whether all the enzymes are fine or not. Another thing, it's very, very important, is obesity. Whenever an obese client comes to me, the first thing I do is check him for fatty liver. So fatty liver, which is the cause for, which is one of the main cause for for how we get sick and all. It is diagnosed with, as I
Doctor,
told you, with SGPT, SGOT, and the gamma GT also.
doctor, your slides.
Increased enzymes level can, be,
Doctor, your slides have not changed.
sorry,
Your slides have not changed, ma'am.
can you see the slides? Can you see the slides?
Yeah, we can see the slides, but they have not changed on the screen.
Is there anything? Is there any problem in the?
You have to give enable editing on the top of your
Oh,
screen
okay, okay.
and put it on slideshow and move to the slide.
Uh, uh,
Could you give, can you just press on the option enable editing on top of your PPT?
I audible?
Yes, ma'am. We had lost you.
Okay, can you see the slide number 1?
Not yet, ma'am. It is.
Should I redo the slides?
Could you share it again?
Can you see the slides now?
No, ma'am. Can
Okay,
you
I'll do it. Okay, I'll again reshare it, yeah?
Yes, ma'am.
Let me know if the slide is changing or not.
Yes, ma'am. Now the slides are visible. We can see it.
Okay. I have just forwarded the slide to Miss.
Ma'am, can you click on your screen and just move?
Now, can you see? I have changed the slide. Can you see?
Yes, ma'am. Now we can see it.
Is it changing?
Yes, ma'am. It is changing.
Okay. So now I'll start with slide 2. Now, hepatitis is a condition of liver, which is our second largest organ of the body, where it gets inflamed. The inflamed liver thus underperforms and is unable to function to its fullest. Can you see the third slide now?
Yes, ma'am. They're changing now. Go ahead.
Okay, thanks. So now I'm just repeating it in quickly so that we reach to the where we were talking. Let us remind ourselves that liver performs many functions to keep the body going well. Liver is a chemical factory, our second largest organ. It weighs around 1.5 kilos. It handles 500 important activities simultaneously at the same time. I have again changed the slide. Can you see? I have changed the slide. Is it visible?
Yes, ma'am. It is changing
Okay.
now.
So now what does the liver do? It protects us against infections and diseases, controls blood sugar levels, removes toxins, regulates cholesterol, aids in blood clotting, make vital body proteins, and aids in digestion. Liver processes nutrients, filters the blood, and fights infection. It produces 800 to 1000 ml, which is nearly 1 liter of bile every day. Now, the bile eliminates waste and harmful debris from the circulatory system. As now we talk about hepatitis, hepatitis can be caused by heavy alcohol consumption, the toxins, certain medications. If the liver is damaged, it should be treated immediately. Neglect would lead to even liver cirrhosis and other liver problems. Now, when we talk about obesity, so the fatty liver, which is the main cause for liver problem, can be diagnosed by the blood test. As I was telling you that, there are many people who go underdiagnosed, they have hepatitis for years and they don't know. And by the way, the liver takes a long time to show its symptom and to get scarred. The cirrhosis starts a long time back. So to get yourself positively known that, oh, I'm working in a hospital, I can have hepatitis, or my food is not great, nothing great. So it can be, so the best is that you do a 6-monthly or yearly blood test and check your enzymes like SGPT, SGOT, the gamma. The increased enzymes levels show that there's a problem in the liver. So early detection of fatty liver can prevent further damage. Liver cirrhosis is expected to be the most significant cause of death. So now let's talk about hepatitis A. Do you know what is the reason for hepatitis A? I'll tell you. It is when you eat dirty food, when it is mixed up, when you don't clean your hands and you cook food and you eat food, maybe the outside leftover food where the bacteria is there, that causes the virus in hepatitis A. So understand one thing, if you want to, of course, there are medicines, well, directly to finish the hepatitis, there is no such medicine, but we can give other treatments, to take care of, like we take care of the diet, we give some medicines, the doctor gives you some medicines to make the liver healthy again. But the main thing is one of the fecal matters, which is mixed with the food. When you eat outside, you drink outside juice, you take raw meats, or the frozen raw meats, which are, which are leftovers. These all, they cause hepatitis A. Another thing is the overconsumption of alcohol also leads to cirrhosis. So the excessive circulating alcohol in the blood will destroy the liver cells, making them inflamed and fatty, leading to cirrhosis. I'll give you a very small example. We go with children out and we eat with them, and they say, "Oh, mom, I want to have a red velvet pastry today." What does the red velvet pastry have? It has loads of the color red, the artificial color. Then it has got artificial flavor. So the moment the liver sees now this pastry is coming, okay, I have to go through it, I have to digest this. The first thing is the liver thinks, oh God, now so much of artificial flavor, so much of artificial color. I have to go through it. Remember, now the liver is getting overworked because it's seeing so many things to process. You know what is the best way? Eat your foods, drink your drinks without any artificial colors and flavors. You're doing a big favor to your liver in that case, because the moment there are artificial colors and flavors, they add pressure to the liver, and the liver starts underperforming on a very slow way. Remember one thing, liver is big and very strong. So these small things, they accumulate and they take time to destroy the liver slowly. So the best is, please do not use anything artificial. You can have all sorts of foods, but stop using at home any colors. These days we have seen so many children having these artificial colors and they are attracted to it. And only then they have, till the drink is not blue, they would not drink. So you have to take care of that. Now, what precautions we must take for so that the hepatitis is not there? The first thing is keep body weight under control. Do you know, have you seen that, if we reduce 10% body weight, 10 to 15% body weight, the fatty liver gets better by 40%, which is such an important figure, that your liver lightens up by 40%, lesser fat in it. If you only reduce your 10 to 15% of body weight with whatever you are right now, little obese or more obese, 1, 2, 3, whichever grade of obesity you have, the moment you start reducing your weight, the liver is absolutely lighter by 40%, which means it can really perform well. It starts performing very well. And please don't forget, it's a very important organ of the body, because many, if you go through it, there are so many functions it performs. So you are actually helping your body the moment you start keeping your weight in control. Now, as you know, that the balanced diet you can avoid putting the liver under the metabolic stress. Exercise burns triglycerides for fuel and can reduce liver fat. We have found a connection between exercise and fatty liver. How? That when you exercise every day for some 45 minutes or 1 hour, the triglycerides and the extra sugars which are already circulating in your blood because you're overeating, because you're overweight, the exercise is fueled by them. So they automatically start reducing, and automatically the liver gets lighter. Of course, we all know we have to avoid alcohol. Now, one thing which is very, which is not taken care many a times, that you stay away from toxins like pesticides, insecticides, the cleaning products. You can sometimes ingest it. And they cause a problem in the liver. They all are injurious to health. For example, for the fiber, it's said that, oh, you must have fruits with skin. Yes, that is in normal case. But where is the skin now, which is natural? It is sometimes nicely coated with the wax. It is many a times these big malls, the food centers, they keep it pesticide free. To keep it pesticide free and to keep it in the best color, they spray pesticides on it. So to have fiber, I these days never recommend the fruit skin. Now, even I would prefer that you de-skin your pear, your apple, and other fruits which skin is eatable, Do not eat the skin because we don't know how good the original product is. Now, getting organic thing, of course, it will help, but not everybody takes organic food. So stay away from the fruit skin and vegetable skin. Clean it well, de-skin it, and only then you use. Hepatitis B and C are basically caused by blood. What happens when it is caused by blood? Many of us go for tattoos. They go to different salons for tattoos. Do you know? Tattoo is one big reason where the hepatitis has started spreading so much, because they use the tattoo machine, and if that machine has been used on a person who's already infected with hepatitis B, then it will come in your blood, and then you're just having this virus of hepatitis B. Now, piercing instruments, you get your ears pierced, your nose pierced. That is also one you have to be very careful. So you cannot just go to any place and do these things. You have to take care of it. Now, also people who are working for the health management, they are working in hospitals, there are used syringes, there are needles which can be pricked. So the best is that you should be immune to this. You should have a vaccine already. Get it if it is in your job to work in a salon, if it is in your job to work for a hospital, in a pathology lab, then please get yourself vaccinated very as and when in time, so that you don't get all this forever. So one thing is that over the counter medication is also responsible. People these days buy anything and everything over the counter. Okay, this medicine. They forget that these medicines finally have to be processed by our liver, by our dearest liver. When it starts processing so many supplements, now there are supplements in between. When there was corona, it was said that you should have vitamin C, maybe have one pill, two pills in a day. So what is vitamin C, which is supplemented from the shops? It is simple ascorbic acid. The more you have it, the more your liver will take time to process it, and the liver will have to be overworked all the time. So if you're eating more, you love sugar, you're not exercising much, you're taking over-the-counter supplements and medicines, and sure, you're not making yourself healthy. So when your liver is unhealthy, what happens? The moment you have eaten outside food, it has got hepatitis A virus, you will immediately contract it, and you will immediately get it. Means your liver is not immune. So the immunity of liver has to be increased by eating the correct food, as I have guided you. In that case, nothing is going to bother you. As I already told you, artificial colors, flavors, avoid using contaminated needles. Practicing safe sex is also very important. Now, safe sex is not directly related. What happens with the unnatural sex, you can have different bleedings, different parts. That is the reason where the hepatitis B virus infects in your blood. So sex is connected when there is blood, some kind of blood happening inside your body due to sex. Yeah. So now taking hepatitis A and B vaccinations is the best way I would suggest, if you are not so precautionary and all that. Do you know that globally over 13 people are infected? Every 100 people, 13 are infected many a time with viral hepatitis. It can go on symptom-free for years, and the damage to the liver it goes on and on. Now there are around 100 million people living with chronic hepatitis B. Many of them are not aware, and 30 million people living with chronic hepatitis C. You don't realize, you don't understand. Many times this goes unnoticed because it's symptom-free. That's why I suggest that you should get your blood reports in a pathology often, just to know if your liver is working well. So, this year on World Hepatitis Day, today's days, it's also the birthday of Professor Baruch Bloomberg, who discovered hepatitis B and developed hepatitis B vaccine. Thank you, everybody. I hope I'm clear. I hope that.
if there are any questions that you would like to ask the doctor, you can put it up in the chat box for her to address, or you could unmute and ask. We would take 2 to 3 minutes for questions, and then we will move on to the next speaker.
You can definitely move to the next.
Good evening, madam. Can you hear me? Good evening, madam.
Ma'am, there is a participant who's asking you a question. Are you able to hear her?
Not yet. Yeah. Now, nobody has asked me. I cannot hear.
Go ahead, Ms. Sumana. You can ask your question.
Good evening, madam.
Good evening.
That was a very informative talk. Thank you very much. My question is, for a patient who has been diagnosed with grade 2 fatty liver, what do you suggest, madam?
So I have many patients who have grade 2 fatty liver. Now remember one thing, fatty liver is directly associated with the obesity, with our lifestyle, with the way we live, we eat more, and the fatty liver starts getting affected day by day. So yes, second, grade 2 means the person has been over, it's like a horoscope. If you have grade 2 fatty liver simply means that, oh, this person is living a couch potato life. What is couch potato life? Means the person is not moving around. He's sitting and eating. And secondly, the person is eating high calorie food. So the only thing we start doing is he must start moving 30 to 40 minutes per day, as I told you, and eat. With fatty liver people, I give them boiled food. We don't give them any oil. Like for obesity, we give 2 teaspoons oil per day so that the person is getting thin. But when it has already affected the liver, means we don't require any minimum of oil, only when it's very important. And we like to, I personally leave half of the day, I give them fruits. For the half of your either lunch or preferably till lunch, we give them, I mean, even the lunch is lunch has only different fruits. And in the evening, we give them very light dinner. This starts improving, and within a month, the grade changes, and within over a period of time, the person starts getting better. So with grade 2 fatty liver, we have to take care of the diet and physical activity. I hope I'm clear. Okay.
Thank you.
Thank you. Is there anybody, please? Okay. I hope I can hear. There has been raised hand, but I hope I can hear.
Hello.
Yeah. Tell me, please.
Hello.
Yeah, hello.
Yes. This is very fruitful webinar. Thank you to you. But I ask some question. I have allergic problem from last 3 years, like red color swelling on my skin, arm, and stomach. When a scratch, press, reddish starts appearing on my body.
Okay.
And some and second thing, my uric acid level 7.4, and every time digestion problem and gas passing, and the face is oily. And so, ma'am, please advise prefer this type the healthy diet plans I take for this according to this symptom.
Okay.
So please tell me healthy
okay.
diet plan so that.
Yeah. Am I
my
audible
body
now?
growth and
Can
stay
you hear
healthy.
me?
Yeah,
Can
yeah.
you hear me? Yeah.
Yes,
Okay. So you know what? What I feel with you is that your body has lots of toxins right now. You know why? Because you're not feeling healthy, your digestion is not correct, you're having allergies, and as you said, it shows on your skin. Simply, you have to detoxify your body. I'm not talking about liver alone. Now, I'll just give you my advice. To detoxify your body, please shift to simple plant based foods. That means now onwards, please avoid dals, legumes because you have high uric acid level. Remember, all this is like a baggage to your liver, to your body. So you must avoid gluten also for the time being because you're having body allergies. So no gluten, no dals. So what do you have? You have rice, you have different kind of
yeah,
vegetables, and you have fruits. Please
yes.
do that. Please do that so your body is detoxified. Anyway, we can talk in detail when I come to know your weight and lifestyle. I mean, then we go deep and we can talk about it. But right now, the best thing is that you should shift to plant-based diet, stop gluten, and I don't know if you're allergic to lactose or milk that you can take care of. But definitely your body is full of toxins right now. That's why you're suffering all this. And you're saying that you have gases also. Is that you said?
Yes, my platelet level is 120
What is
and
that?
120 platelet level count my.
Okay. Okay. So, you
And
have to.
and second things, allergic test I have to take, and pathology lab immunological globulin IgE level 13 IUL.
Okay. Okay, fine. I would love to shift you to a plant-based diet and gluten-free. That is the best thing you can do right now to detoxify your body. Even your uric levels will go down in that. Even
This,
I mean, it affects the
this
whole
type
body.
of
That
the
would be the
fruits and
best.
vegetables. Yes, yes. Okay.
Yeah.
Which type of fruit and vegetables I take
All,
such
all, all,
type.
all, all
Oh,
fruits and vegetables you can take. All.
okay. Okay,
Yeah.
ma'am.
Ma'am, we have a few more questions from the
Yeah,
audience
sure,
and
sure,
on
sure.
the chat box as well.
Okay, I'll just,
Ma'am, I have a question here.
yeah.
Basically, see, a person, I was diagnosed with fatty liver grade 1.
Sorry, what were
Sometime
you
back.
diagnosed with?
Fatty liver grade 1. Grade
Okay,
1.
okay.
Now, I never had alcohol in my life, and I've also been always thoroughly having a very low fat diet overall, and a very balanced, not any processed foods or any foods which have a lot of colors and all that in them. So, and even I have multiple gallstones in my gallbladder. So, is this gallstones also a reason for, hepatitis A or
No,
fatty liver?
I don't think so. I don't think so. May I know your weight and height?
My height is 5'7"
And
and weight is 68 kgs.
okay, so you are not obese at all.
No, no, no,
Yes,
no, not at
yes,
all.
I know. Gallstone should not play any role in fatty liver. It should
Okay.
not. Is as you said, your food habits are good, low in fat. Have you ever
Yes.
been on a high calorie diet before, or
Yes. In the
huh?
in some time, some years back, I was having a lot of outside food
Yeah, that is
regularly.
there, and also sedentary lifestyle. That means no physical activity.
Yes, it was very low
So,
activity
so
that time.
we then if right now your weight and everything is fine, then we can ignore it. It shouldn't happen. It will go away.
Fatty liver is treatable. I mean, naturally it goes away if everything weight is corrected and you start exercising.
Yeah, with your height and weight right now, I would say that it should not be a problem. And are you taking care of eating the food and everything well now?
Yes. Now, someone has suggested me like having cereal like ragi and poha along with coffee is very good for the liver. I don't know. I don't find any research with the coffee, but they have claimed like many doctors that drinking coffee helps to heal the liver faster.
I think there is no such research.
Especially,
I wouldn't.
okay,
No,
okay.
I don't think so. I don't think so.
But it's not harmful for the liver, right? Coffee.
No, it's fine. 1 to 2 coffees in a day is perfect for the body.
Okay.
It wakes you
Okay.
up, it wakes you up. Why you feel more alert? The caffeine in the coffee, it wakes you up and it helps. So a couple of coffees, 1 to 2 coffees in a day is fine. Is
Just
fine.
one half glass coffee in a day will
That's
not
fine.
be.
That's fine.
Yeah.
Poha has nothing to do. Poha is, again, because it comes from rice, it is the most non-allergic food. So
Yeah.
it's fine for the body. There's nothing
And
wrong.
even nachni, the ragi
Yeah,
flour.
the nachni ragi. Yeah, that is healthier. That's a very, very healthier version of these grains. It has got high fiber, high calcium, some good form of proteins, some B vitamins in a full group. They are good.
Right.
Nachni is very
But
good.
then eggs are also okay. It's okay to
Yes,
have egg,
yes,
boiled
no,
eggs,
yes, yes,
fatty
for
milk.
sure. Yes, yes, yes. You must have an egg every day.
Okay.
As the
Because
person before you,
egg yolk
yeah,
is very high in fat. No? Egg yolk.
no, no, it
Egg
has.
yolk.
Remember one thing: when you talk about a full egg, all the good nutrients are inside the egg yolk. So if you take
Okay.
egg white, it will not be useful. If you say, okay, I'll have 2 egg whites, 4 egg whites, it's plain and simple protein, but all the nutrients are inside the egg yellow. I would suggest you to have every day or at least 4 to 5 times a week, 1 egg on daily
Okay.
basis.
Okay.
Because since you are not obese, you are not overweight, so it's
Right.
perfectly okay. It's perfectly okay.
Okay, because I had a diagnosis of hepatitis A, and then I also had very high SGOT, SGPT levels and bilirubin levels, and then it got normal, and again the bilirubin levels shot up a little bit. So I think this is a recovery phase, a yo-yo effect. It
Yes,
starts and again.
I would also say that, we have when our patients recover from all this, and sometimes their enzymes of liver are still high, you know, the SGPT, SGOT, the bilirubin level, everything is high. So when we ignore it for a while and retest it again in a couple of months, they come back to normal.
Okay, so it takes at least 2 to 3 months to completely heal
Yes,
from
yes,
hepatitis
yes, yes,
A and
yes, yes,
high.
yes.
Okay, okay.
It takes some, let me tell you, with few patients,
Yeah,
it comes back quickly, you know, to
right.
normal enzyme levels. But with some patients, it goes on for few months, not 2, 3 months, sometimes few months.
6 months also, 4, 5 months.
It goes, yes. And sometimes we
Okay,
really don't understand that when everything is going right, why the enzymes
exactly.
are still high, but they are high.
Because that's what doctor was also confused that everything had gone normal and then again the enzymes go high a little bit. So again the medicines were started, and now the diet has to be restricted till the bilirubin levels and enzymes come to normal level.
Remember one thing, what the green leaf juice, especially parsley and celery. If you take its soup every day, if you boil some water and add these in handful, this is a natural way of reducing your SGPT, SGOT. It's very
Parsley
helpful.
and celery.
Yes, parsley and celery. Maybe
Okay.
1 handful parsley, 1 handful celery, small cut, well cleaned. Boil it in at least 4 to 6 glasses of water, and wait till the water has reduced to half. Drink it in a day. You do this at least 2 times a week. It helps a lot in the SGPT, SGOT.
Okay, ma'am. But milk is supposed to be restricted in jaundice related to this
No, not
hepatitis.
really. Not really.
I'm sorry, Dr. Seth and Ms. Gupta. I understand the discussion is going very well and interesting, but
I
we
know,
are
yeah, we should
running,
give time to the next
yes,
participant.
we are running
Okay, I'm
short on
Please,
sorry.
time.
you're
Okay,
most
yeah,
welcome.
yeah.
Thank you so much.
Thank you. And
Thank you.
so, to all the others who have raised your hands, you can put your questions on the chat box.
Yeah,
And, Doctor, you can reply through the chat box. We
sure,
have
sure.
a
I would
Google
do that. I
access.
would do that.
But thank you so much for all the questions we have
I
received.
hope it was a simple and clear understanding for the whole thing. Thank you.
All right, so next we would be moving on to our next speaker, who's Dr. Ipala Vedavati Ganesh, an MBBS graduate from NRI Medical College, Mangalagiri. She formerly worked as a medical officer at Binyan University. So, doctor, I would like you to share your thoughts and go ahead with your speech, ma'am. Thank you. Am I audible and visible? Yes, ma'am, you're audible and visible.
Good evening, everyone. Thank you, USFN, for inviting me on the occasion of World Hepatitis Day. And thank you, Geeta ma'am. You had given a very beautiful presentation today. And I would like to start my presentation. Just a minute. Sharing my screen. So, welcome everyone. So, World Hepatitis Day, which is celebrated on 28 July 2022, that is bringing hepatitis K closer to you. I'm Dr. Vedavati Ganesh, and today I'm going to briefly explain you about different types of hepatitis viruses. Already Dr. Geeta ma'am have mentioned very briefly in her presentation, and I would like to add some more points to it. So the first and foremost question will be, what is hepatitis? So hepatitis, as most of you know, it is the inflammation of liver cells. And these liver cells are known as hepatocytes in medical terms. And so the inflammation of hepatocytes is termed as hepatitis. And whereas inflammation means it's a protective reaction performed by the body when exposed to various trigger factors like injuries or diseases or irritation of the tissues. And thus our body reacts by destroying those trigger factors as well as our own tissue, thereby causing damage to the liver cells. And these trigger factors, that is various causes of hepatitis, include viral hepatitis, which is the most common and leading cause in the world, causing hepatitis. And the other conditions come autoimmune hepatitis, wherein the one's own antibodies destroy the own tissues itself, which may be due to genetic predisposition or can be following viral infections like measles or herpes simplex virus or Epstein-Barr viruses. And then comes the alcohol. Alcohol, as most of you know, it can cause, on a long-term basis, it can damage your liver. So around 7 beers a day for about 20 years would lead to alcohol-induced hepatitis. It may be looking very long, but it may depend even on the sex of the individual and age of the individual and immune status of the individual too. And the other reasons will be the drugs and toxins, drugs such as even the medical over-the-counter drugs like aspirin or paracetamol or oral contraceptive pills or steroid hormones. All these can also lead to hepatitis when they are taken on a long-term basis, if they are taken very rarely, it is quite fine. If they're taken on a long-term basis, it can lead to hepatitis even. And toxins, as Geeta ma'am said, some adulterated foods, pesticides, insecticides, and sometimes poisonings even, these can cause hepatitis. So the second question will be, why is it celebrated on 28 July? It is just in remembrance of Dr. Baruch Blumberg sir, and he discovered hepatitis B way back in 1967. And he even developed a diagnostic test to detect hepatitis B virus and also developed the first hepatitis B vaccine. And he was a Nobel Prize winner too. And why is hepatitis such an important disease to discuss now? So as per WHO, there are over 1 million people per year suffering from liver cirrhosis or cancer due to these viral hepatitis, especially hepatitis B and C across the world. So this is a quite large number. It around 3,000 deaths per day occur in this because of these viral hepatitis complications. Thus, WHO has brought up with a theme that is bringing hepatitis care closer to you. That is, it aims at raising awareness about the need to simplify and bring hepatitis care from the level of specialized doctors and the tertiary level of healthcare centers to the level of primary health centers and unspecialized doctors and community-based venues and locations, such that the care is very much closer to the communities and the people wherever they are. And WHO also aims at eliminating the viral hepatitis by the year 2030, and it has set up some specific targets, which include reducing the new infections of hepatitis B and C by 90%, and reducing the hepatitis-related deaths from liver cirrhosis and cancer by 65%, and ensuring at least 90% of the people with hepatitis B and C virus are diagnosed, because most of them are undiagnosed, as already Geeta ma'am mentioned it. So most of the hepatitis B and C infected persons are undiagnosed and untreated. That's why the prevalence is very high. So it has set a specific goal so that at least 90% of the people with hepatitis B and C virus are diagnosed, so that we can eliminate viral hepatitis by 2030. At least, and out of that, at least 80% of should receive appropriate treatment. Hereby, I will be telling you briefly about different types of hepatitis viruses, their symptoms and all. Before that, briefly I'll mention about the liver and its functions. Liver is the largest solid internal organ, weighing around 1.5 kg on an average. It is located in the upper right quadrant beneath the ribcage and lungs. And liver is having many responsibilities to do, such as metabolic, that is metabolism of carbohydrates, proteins, and glucose, and fats, which we intake regularly in our diets. And storage function, it stores glycogen, which is necessary, which is used as energy fuel during the fasting and starvation states. And it also stores vitamin A, which is very much important for our immunity. And synthetic function, it synthesizes many proteins, immunoglobulins, which are necessary to fight against the diseases and also clotting factors. And excretory function, it balances the cholesterol level by excreting the excess cholesterol produced in the body. And it also helps in excreting certain drugs which are harmful to our body, and bile secretion, which are needed for the digestive processes. And liver is also having hemopoietic and hemolytic functions, especially in the stage of fetus, and sometimes in case of thalassemia or sickle cell anemia patients. And it is having the role of inactivation of hormones and drugs, defensive and detoxification functions. So the main topic today, that is different types of viral hepatitis. There are 5 types: hepatitis A, B, C, D, and E. Whereas hepatitis A and E usually causes the acute viral conditions, acute hepatitis conditions, whereas hepatitis B, C, and D can cause acute as well as the chronic infections too. So how do we differentiate acute and chronic? Means depending on the symptoms and the diagnostic tests. If the symptoms and the diagnostic tests show the virus for less than 6 months, we consider it as an acute phase. If they remain for more than 6 months, then we consider it as a chronic phase. And interesting but adverse fact is that hepatitis B and C are the leading cause of viral hepatitis related liver cirrhosis, liver cancers, and deaths. And this accounts for around 354 million cases worldwide. That is approximately 4.5% of the world population. That number is quite high. So now I'm going to tell about each virus, how it gets transmitted and its incubation period, what are the symptoms the patient is going to develop, and the diagnosis and treatment, which is of a major concern for the physician, and the preventive measures, which you need to focus. The first virus is hepatitis A. It is an RNA virus belonging to the virus family Picornaviridae, and RNA virus implies the genetic material of the hepatitis A is made of RNA. And the modes of transmission for hepatitis A are ingestion of the food and water contaminated with the feces of an infected person, and sometimes when exposed directly with the infected person if he is not washing his hands properly and regularly, and sometimes when having oral-anal sex with an infected person. And the incubation period, that is the period between the exposure of an individual to the infection and the development of the symptoms of the infection. That is around 14 to 28 days for hepatitis A, and it varies from individual to individual depending on their immunity status. And most of the times the patient remains asymptomatic. So we all might also get infected with a hepatitis A, but most of us would have remained asymptomatic because of our good immune status, and the virus load might also be sometimes low. But if the patient's immune status is very low and the viral load is also very high, then the patient may develop symptoms like fever, fatigue means weakness, anorexia, that is lack of appetite, diarrhea, that is increased frequency of stools, nausea, that is a vomiting like sensation, and abdominal discomfort, abdominal pain, dark colored urine, pale stools, and jaundice. Jaundice is nothing but yellowish discoloration of your skin and eyes. So all these occur because of the altered liver functions only. And these symptoms usually are self-limiting, but can sometimes relapse after a recovery phase and can enter the fulminant hepatitis stage, that is the severe hepatitis stage. And in case of hepatitis A, it is seen in one case in about 2 lakh cases of hepatitis A. So it is quite rare, but if one enters into the fulminant hepatitis stage, it may lead to death. And diagnosis, as these hepatitis symptoms are common for any kind of hepatitis, so diagnosis is not made based on clinical tests. It should be diagnosed by certain diagnostic tests, like detecting the antibodies specific for that hepatitis A virus. So using that anti-HIV IgM antibodies, we usually diagnose the hepatitis A virus specifically. And coming to treatment, it is, as I mentioned earlier, it is self-limiting and no specific treatment is available. And there is no need of hospital admission also, unless it is a fulminant case. And it's better to avoid alcohol and liver-affecting drugs like aspirin or paracetamol or painkillers. And supportive treatment is to be provided in the form of adequate nutritional balance and replacement of fluids which are lost from vomiting and diarrhea. And the prevention part, this is mainly based on the modes of transmission only. As we understood that, it is very easy to understand this. So adequate supply of safe drinking water and proper disposal of the sewage within the communities has to be done at the community level to prevent hepatitis A effectively. And personal hygiene practices like regular hand washing before going to meals and after going to bathroom, and keeping the surroundings clean are to be done at the individual level to prevent hepatitis A. And the vaccine named Haverix is available for the adults and children more than 1 year of age. It is given as 2 doses, 6 months apart. And the immunity starts after 4 weeks after vaccination and lasts for about 20 years. And this is not included under national immunization schedule in India. So one has to approach the healthcare facility to get the Haverix vaccine. If already infected with hepatitis A, immunity would produce antibodies and memory cells, so that no need of vaccination usually. This is briefly about hepatitis A. Then coming to hepatitis C, it is also an RNA virus belonging to family Hpv, and over 20 million cases are reported worldwide every year with a mortality of 3.3%. That is around 66,000 deaths have been seen every year due to hepatitis E. And transmission, it can be just like a hepatitis A, like an outbreak following the infected fecal contamination of water supplies and food, or sometimes can be a sporadic, that is very rare. And it is due to virus genotype of animal origin infected from eating undercooked animal meat. And the incubation period for hepatitis E is around 2 to 10 weeks. So you can develop the symptoms within this period after getting exposure to the hepatitis E. And the symptoms, just like hepatitis A, include mild fever, anorexia, nausea, and vomiting, abdominal pain, and sometimes can have itching or skin rash, generalized skin rash, and joint pains, jaundice, and dark urine and pale stools. And even hepatitis E can enter into a fulminant stage, but the rate is very high compared to hepatitis A. That is 1 to 2% cases have been seen with the hepatitis E. And in pregnant ladies, hepatitis E is having some major role. If they are infected in the second or third trimester, that is in the late pregnancy, there will be an increased risk of acute liver failure, fetal loss, and mortality can be seen. And chronic condition with hepatitis A, we do not usually see the chronic hepatitis A, but with hepatitis E, in case of immunocompromised individuals like organ transplanted individuals or people living with HIV or AIDS, or someone who is having some uncontrolled and severe diabetes, they may develop hepatitis C into fulminant hepatitis into chronic phase. And diagnosis is made with a viral specific immunoglobulins, and in sporadic settings we can detect for a hepatitis E virus RNA using RT-PCR tests. And treatment is self-limiting as it is acute condition, and no need of hospital admission, and avoiding alcohol and drugs is better, and adequate nutrition and hydration is to be provided. But there is no vaccine for hepatitis C, and for immunocompromised individuals, we need to use antiviral drugs like ribavirin and interferons. We need to admit them to the hospital and give these drugs to them. And coming to the prevention part, same as the hepatitis C, but except there is no vaccine for hepatitis C in India, even in other parts of the world except China. So one has to concentrate on the other preventive factors too. Coming to hepatitis C virus, this is an RNA virus belonging to family Flaviviridae. Globally, an estimated 58 million people have chronic hepatitis C infection, with about 1.5 million new infections occurring per year. Around 3 lakh people died in 2019 because of hepatitis C complications. And the incubation period for hepatitis C is around 2 weeks to 6 months. That is quite longer. And transmission, it is a blood-borne virus. It is to be noted that is a blood-borne virus. So the most common route of transmission is by reutilization or inadequate sterilization of the medical equipment, especially the syringes and needles used in the healthcare settings. So that is the most common route through which hepatitis C is getting transmitted. And the other major modes of transmission include transfusion of unscreened blood products before transfusing, and sharing needles among the intravenous drug users also. And the other two least modes of transmission in hepatitis C include vertical transmission, that is from mother to baby when the baby is getting delivered, during which the baby's blood gets exposed to the mother's blood. So that is one other modes of transmission, and the sexual practices are the least modes of transmissions. But one thing to remember is hepatitis C do not spread through breast milk. So a mother with hepatitis C positive infection can breastfeed her baby. And sharing food and water and casual contacts such as hugging, kissing with an infected person also do not transmit hepatitis C usually. And coming to the symptoms, only 20% of the people infected develop an acute stage, and around 15% progress into the chronic phase. And they can be asymptomatic and sometimes can present with chronic fatigue, or sometimes with liver cirrhosis or liver cancer, but with a slow progression over 20 years. So this has to be noted, that is slow progression over 20 years. So it is taking a very long time. So if it is diagnosed earlier and treated earlier, so that we can prevent the stages of fibrosis, cirrhosis, and hepatocellular carcinoma, and ultimately death can be prevented if it is diagnosed earlier. And a few chronic cases, along with the liver manifestations, sometimes can manifest extrahepatic features like diabetes mellitus or autoimmune thyroiditis, where the thyroid gland gets inflamed, and Sjogren syndrome, where there will be a dry mouth and dry eyes, and MPGN, it is a pathology related to the kidneys, and several other conditions may manifest. So coming to diagnosis, most of the times people won't go to hospitals to get diagnosed with hepatitis C. It is diagnosed while screening for the other diseases or while working up for unexplained fatigue. And we use viral specific antibodies and HCV RNA to diagnose it. And HCV RNA is used to distinguish between acute and the chronic phase. If HCV RNA remain positive for about more than 6 months, then it is considered as a chronic phase. And treatment, coming to treatment, the supportive treatment for acute phase is enough. And for chronic phase, we need to administer the antiviral drugs as mentioned for about 12 to 24 weeks. And with a proper and adequate treatment, hepatitis C can get cured in about 95% of individuals. So it is a curable disease, but only the thing is to get diagnosed earlier. That's it. And prevention, there is no vaccine for hepatitis C infection. So we need to concentrate on the other preventive measures like safe and appropriate use of healthcare injections. Like we need to use the disposable injections only. We should not reuse the injections. And safe handling and disposal of the sharps and waste, especially in the healthcare settings, and prevention of exposure to blood during sex, and testing of the donated blood for hepatitis B and hepatitis C virus prior to transfusion, along with the HIV, syphilis, and malaria. So all these 5 diseases should be tested before transfusing the blood to a person, and it is mandatory. This is all briefly about hepatitis C. Coming to hepatitis B virus, it is the only DNA virus among all the hepatitis viruses. All other are the RNA viruses, and it belongs to the family Hepatnaviridae. And WHO estimates around 296 million people were living with chronic hepatitis B in 2019, with 1.5 million new infections per year. And in 2019, they have noted around 8.2 lakh deaths occurred worldwide from liver cirrhosis or liver cancer due to hepatitis B. If you have seen, there is an increasing trend. So with hepatitis C, only around 70,000 deaths are seen. That is not only actually a great number only, but compared to hepatitis B, it is less. And hepatitis C, with hepatitis C, there are around 3 lakh deaths per year, and with hepatitis B, there are around 8 lakh deaths per year. This shows that hepatitis B is more prevalent than remaining all other hepatitis viruses. And the incubation period for hepatitis virus is 30 days to 180 days, that is around 1 to 6 months. And transmission, the most common route is a perinatal transmission, that is from mother to baby in a highly endemic areas, that is highly prevalent, disease prevalent areas. And the other modes are needle stick injury, tattooing, and piercing, where the needles are reused usually at most of the places, and exposure of the cut skin or mucosa to the infected blood and body fluids such as saliva, vaginal or menstrual or seminal fluids. So it has to be noted, exposure of the cut skin or mucosa only, not the direct surfaces. So intact and intact surfaces wouldn't transmit the virus, only the cut skin or mucosa will transmit the virus. And reuse of contaminated needles in the healthcare settings or among the persons who inject the drugs, it is one of the modes of transmission. And in sexual transmission is also seen in hepatitis B, but usually it is in case of unvaccinated persons only. And one of the interesting factors, if hepatitis B is acquired in infancy and childhood, 95% cases will progress to the chronic phase. And if it is acquired in the adulthood, only 5% of the cases will progress to the chronic phase. The simple logic is just because of immunity of a child is more than immunity of an adult is more than immunity of a child. And symptoms, coming to symptoms, most people won't develop any symptoms in the acute phase, remain asymptomatic. Only very few persons who are having less immunity will progress to acute illness, and which may last for several weeks and goes on with the time, and with adequate nutrition and hydration. And around 95% patients recover from the hepatitis B, but 5% may enter into the chronic phase. In case of hepatitis C, around 15% enter into the chronic phase. In case of hepatitis B, only 5% cases enter into the chronic phase. And they may remain asymptomatic and or may present with fatigue or intermittent jaundice, or extrahepatic features may also manifest. And around 95%, so that's the point repeated. And diagnosis is made based on different antibodies and antigens, and HPV DNA and HPE antigen are used to distinguish between acute and chronic conditions. Treatment, there is no specific treatment for acute illness, and for chronic phase, antiviral drugs like tenofovir and entecavir are to be given for lifelong. So we should be monitoring the liver enzymes and bilirubin values and all these, and we should be adjusting the doses of these antiviral drugs, and we should continue the treatment for life, because hepatitis B is not a curable disease, but there is only an effective treatment for hepatitis B, whereas hepatitis C is a curable disease. And prevention, the major part of prevention in hepatitis B is a vaccination. So in India, under national immunization schedule for infants, the initial dose is given within 24 hours after birth, and followed by at least 2 doses, or if possible 3 doses at 6, 10, 14 weeks of life. And protection usually lasts for about 20 years and probably for lifelong. And for healthcare personnel or adults who are at high risk, for healthcare personnel means who are at high risk where they are exposed to more cases, they need to take 3 doses at 0, 1, 2 months. That is 0 dose on today, and 1 month later the second dose, and 2 months later the third dose has to be taken. And the other methods are prophylactic administration of antiviral drugs. So I have mentioned that the most common route is from the mother to the baby. So every pregnant lady should get tested for hepatitis B virus and HIV and also syphilis in their first visits. So that if any positive infection is noted, immediately the treatment has to be started so that the mother won't transmit the virus to the baby. So prophylactic administration of antiviral drugs is done in case of hepatitis B to prevent transmission from mother to the child. And blood safety strategies has to be followed before blood transfusion, and safer sex practices like using barrier contraceptives might be helpful. This is all briefly about hepatitis B. And coming to hepatitis D, it is an RNA virus belonging to family Chlamydoviridea. It is a special virus actually because it doesn't exist alone. It is always associated with hepatitis B infection because it needs hepatitis B virus DNA material for its replication. So it never occurs alone. It occurs either as a co-infection with hepatitis B or as a super-infection to hepatitis B. So in case of co-infection, it occurs during recovery from the hepatitis B virus and can cause a second peak of jaundice. And in case of super-infection, it can occur during the chronic phase of the hepatitis B virus. And 20% of the co-infection cases can progress to fulminant hepatitis stage, that is the severe form, and majority of the super-infection cases can progress to the stage of liver cancer earlier than with hepatitis B infection alone. That is, if hepatitis B alone is there, it leads to liver cancer. But if there is hepatitis B and D are there, the patient would get the liver cancer much more earlier. So it is dangerous. And diagnosis is made using this viral specific IgM antibodies and hepatitis D virus RNA, but not used routinely. And treatment is interferons alongside antiviral drugs for the hepatitis B and to be used cautiously. And preventing hepatitis B will prevent the hepatitis D also, because they both usually exist together. I mean, hepatitis D will exist only with hepatitis B in presence. This is all briefly about viral hepatitis different types. And lastly, HPV and HIV co-infection, regarding that, a few points. So the persons with any one of the infection in HPV or HIV will usually get the other infection also because their immunity status will be lower. So as per WHO statistics, about 1% of the persons living with hepatitis B virus will also develop are also infected with HIV virus. But conversely, HIV virus people, they get around 7.4% of cases of HPV are noted in people living with HIV. And from 2015, fortunately, WHO has recommended to start treatment for everyone diagnosed with HIV infection, regardless of the stage of the disease. Priorly, we used to give the treatment for HIV infection depending on the T cell count. But now, as per WHO, so immediately after diagnosing with HIV, we can start the treatment for it. And the most useful drug is the tenofovir, that is an antiviral drug given, which can be used commonly for hepatitis B virus and also HIV infection. So it is used as a first-line treatment in case of HPV and HIV co-infection. So hereby I end my presentation with some take-home points. So most common cause of hepatitis in the world is viral hepatitis, and it is the World Viral Hepatitis Day is celebrated on 28 July in honor to Dr. Blumberg. And 5 types of viral hepatitis are noted, that is A, B, C, D, and E. Hepatitis A and E cause acute and fulminant infections. Hepatitis B, C, and D cause chronic infections of the liver, and they can lead to complications, major complications like cirrhosis and liver cancer. And the common symptoms include diarrhea, stomachache, stomach discomfort, dark urine, fever, and flu-like symptoms like cold, cough, headache, and myalgias, that is body pains, and the generalized rash all over the body, and lymphadenopathy, like few lymph nodes enlarged in the inguinal or axillary area, and pale stools, yellowish color of the skin and eyes, and sometimes liver and spleen may get enlarged in case of chronic conditions usually. These symptoms will persist for less than 6 months in case of acute hepatitis conditions, and in case of chronic conditions, these may persist for more than 6 months. This is the comparison table among the different viral hepatitis. So as I mentioned, hepatitis B is the only DNA virus, and remaining all are RNA viruses, and the fecal-oral route of transmission is seen with hepatitis A and B, and the blood and other body fluids transmission is seen with B, C, and D viruses. And incubation period varies for different viruses, and it is very shorter for hepatitis A and E and longer for hepatitis B, C, and D viruses. And the diagnosis based on viral specific antibodies and antigens, and possibility of chronic infection is with hepatitis B, C, and D, and rarely with hepatitis E, and nil with hepatitis A. And vaccine is available for hepatitis A and hepatitis B viruses only, and C, D, and E are currently not having any vaccines. So always prevention is better than cure. So I have explained specific preventive measures for each and every hepatitis virus, and these are all in brief. So maintaining good hygiene and keeping the surroundings safe and clean, and taking vaccination for hepatitis A and B at appropriate schedules, and safer sex practices, using contraceptive barrier contraceptives, and avoiding alcohol, and ensuring the safe injection practices in healthcare settings, and avoiding the contaminated food and water. So be safe, be cautious, be healthy, and be happy. Thank you.
Thank you, Doctor, for sharing your presentation. It was very informative. We will take 2 minutes for any questions. I would like to inform the participants that we have extended the time by a lot due to a lot of factors. So kindly please limit your questions and ask them in a very short and brief way. You could even type it on the chat box, and the doctor would be happy to address it for you.
So somebody has asked, will 3 doses of vaccine for hepatitis B give hyperimmunity? So no such condition like hyperimmunity with 3 doses of hepatitis B vaccine. It is must and needed. At least 3 doses of vaccine needs to be given, even for infants or for adults. It is safer only.
Thank you, Vedavati ma'am. Just one question here.
Yes.
For a layman, how can one ask for these tests? Like just like we have this fasting blood glucose, which are more familiar with everyone. For hepatitis, what are the diagnostic tests which a layman can ask?
So you need to mention, I mean, first of all, you need to have some symptoms to go to a diagnostic center to get this diagnostic test done. You can mention it like, I'm suspecting this kind of symptoms. You can mention it to your treating physician also, so that they will go for this test only. Those antibody tests are the specific diagnostic tests. That's it.
Thank you.
Any other questions?
Hello, ma'am. I had a question. Now, is gallbladder stones anyway related to hepatitis A recurrent infection?
No. Hepatitis A virus is usually, we get it from contaminated food and this
Because
water.
once you have got it, you don't get it again. That's what the doctor says, right?
Usually, yes, because your immunity will produce some antibodies. So once again, if you get infected with the same virus, these immune cells already, there are antibodies in our body. So they fight against the virus when it is in the low quantities itself. So usually we don't develop until the patient is immunocompromised or the patient's immune system is very low.
Like if someone has got it twice, that means his immunity is very low?
Yes. or the viral load might also be high.
Okay. Address to the speaker. All right, I believe that there are no more questions, and I would like to proceed to conclude the session. Let me begin by thanking our expert speakers for lending their time to impart their knowledge on hepatitis on this World Hepatitis Day. I would like to thank all our beloved delegates for actively participating in the webinar. It's been wonderful listening to your questions and your discussion. The certificates for your participation will be provided to you in 4 to 5 working days. You will receive the required information through your email that you have registered with. I hope this has been a great and informative session to all of you. I would like to take a few seconds to talk to you about the upcoming Food and Nutrition Conference. The Universal Society of Food and Nutrition, USFN, and BioLeagues worldwide are organizing the 5th International Conference on Food and Nutrition. It is scheduled to take place on the 16th and 17th of November 2022 in Kuala Lumpur, Malaysia. It is a hybrid event. It is a 2-day event where you can witness keynote sessions and paper presentations. The abstract submission and registrations are open for this particular conference. There are exclusive discounts that are available for virtual registrations, and they are valid till the 15th of August 2022. I repeat, there are exclusive discounts on virtual registrations. They are valid till the 15th of August 2022. Do not miss this opportunity. It's a wonderful chance for you to display your work, connect with your peers and colleagues, educate yourself about the latest happenings of the food and nutrition industry, and also to build your own network. For registrations and details, I am pasting an information on the chat box for you so that you can contact that information and get even more details about this conference. I have pasted the contact information for participating in the conference on the chat box. So there has been a request on the chat box saying to share the brochure of the conference as well. We'll make sure to include that when we email you regarding your certificate. Once again, thank you to all the delegates, to the participants for actively participating. Thank you to Dr. Geeta Seth and to Dr. Vedavati, Ipala Vedavati Ganesh as well for your information and the knowledge you have shared with us on hepatitis. This is your host, Julia, and I am signing off for today evening. I hope to see you all soon. On that note, please take care, stay safe, and until you meet again.